Hi, I'm Dr. Martini, part of May Grant Associates. I've been a part of the practice for about 8.5 years now, and have come to love Lancaster and what I do. My training basically primarily was out at in York, where I did my residency and then came to May Grant as my first job, and I've been here ever since. I think we have a great group of people here, including midwives, nurse practitioners, and physicians. I've tailored my practice to be a little bit more involved in minimally invasive surgery. I practice general OBGYN and see patients for annual exams, for when they're pregnant or any other problems, but have focused my surgical practice to minimally invasive surgery, specifically robotics. So minimally invasive surgery is a way of doing really big surgeries with little tiny incisions. So one of the most common indications for these types of surgeries are for patients who have problems with their periods. That could be real heavy periods, it could be really painful periods, maybe irregular periods, or maybe you're just sick of your period. What we do is robotics is primarily used to do hysterectomies, and that's when your uterus is taken out. That can include taking out the cervix, the uterus, the fallopian tubes, and sometimes even the ovaries if the indications are there. So imagine a situation where you could get rid of your heavy bleeding, you could get rid of your irregular bleeding, you could get rid of your painful bleeding, and maybe stay in the hospital one night and then go home the next day. That type of surgery creates some huge advantages because the hospital stays are shorter, the recoveries are shorter, pain is a whole lot less after surgery, and if you're worried about scarring, the scars are literally about that big, which is about 5 millimeters. So you come into the hospital, we do your surgery, you stay one night in the hospital, and then you get to go home. And then the rest of the recovery is at home for a couple of weeks. Now that doesn't mean you're stuck in bed doing nothing, it just means that you have a couple weeks of downtime to be able to recover and rest. Patients do really well with these surgeries. We've seen tremendous leaps in laparoscopic and robotic surgery, and this has taken off over the last few years. The advantage that I have is that I started doing robotics from basically when it came out. I started my residency and basically from day one started doing robotic hysterectomies. So even though I'm one of the younger people in the group, I have a ton of experience when it comes to doing robotics because I've done it from the beginning. So if you are at a point where you're done with your childbearing and you feel like periods are a real problem, or maybe you have a lot of pelvic pain, or maybe there's a history of cancer in your family or personally, maybe robotics is an option for you. I would tell you if any of those things come into play and you're done with childbearing, give me a call and maybe we can talk. There are patients that are great candidates for it and there are patients that aren't, but we can figure that out in the office. If you have any questions, just give us a call and I would be glad to have an appointment with you guys.